Hello, my name is Dr. Basil Considine. I am here from the ACU Online Writing Center, and today we're going to talk about targeted literature searches. A literature search is a common task that is used in many different assignments and across many different programs here at ACU. Essentially, a literature search asks you to go look for something on a specific topic or to inform an exploration of a problem, and it can be used in everything from an annotated bibliography to a literature review to a dissertation, and just to get sources to enhance and ground observations in a paper. The specific assignment that we'll be using as the basis for our discussion happens to come from the Healthcare Administration program, but similar principles can be explored in just about any assignment that requires that you find resources to use. Because this is a skills-based targeted webinar, we'll be spending most of our time doing hands-on searching as a demonstration that I encourage you to follow along. There will be less drafting on the particulars of the assignment and more on how to find the things and some ways to do that more efficiently. As such, we're going to pass through the normal introductory material because the semester is well underway. You can see this in just about any of our other webinar recordings. So our main learning objectives today are to understand the core principles for literature search, to look at the specifics of this assignment, and then to talk about how to do the search, outlining, and drafting process. So let's talk about those literature search principles. Principle 1, keep it relevant. You want to make sure that you're looking for literature that is directly relevant to your topic. While you can use more adjacent sources, you want to start with what is the most directly relevant, what is the most helpful, most applicable to your situation, and if you're not finding what you're looking for, then to broaden. But for example, if you're researching healthcare in the United States, we have a particular combination of public and private where you have Medicare and Medicaid as a public component, but not accessible to all at all ages. And then we have the private healthcare system. Now, there are other countries that have a public and private system, but it's helpful to look at something that is directly comparable. So if there's another one that has, say, the healthcare for the elderly kicking in at 65, well, that is going to be more directly comparable than if they have healthcare from the public system throughout their life. And you might also be looking at things like, oh, let's look at countries with a similar socioeconomic split, or with a similar GDP per capita, or anything like that that helps you make sure that the things you're looking at are comparable enough to gain relevant insights. Second principle, keep it current. Now, what constitutes current is driven by a number of factors, but a general rule of thumb that most professors agree with is that last 5 years can be considered current in most cases. Now, it is entirely possible that things will happen in a short period of time that, like the passage of a new law affecting healthcare reimbursements, or regulating something, or a new set of guidelines for reimbursement, in which case you might move that 5-year marker up, or move it back a little bit. And one of the things to keep in mind is that you want to look for a watershed moment, something that changes how things function, and inform your search accordingly. So, for example, the passage of the Affordable Care Act, it's enacting into law, and the activation of certain things, because it wasn't all in place day one. There were some things that were planned to phase in a couple of years later. If you are doing anything that involves healthcare, the insurance and reimbursements, though that made some fairly dramatic changes about that, as well as people's physicians and other things like that. So basically, you looking for something like that might significantly change how people function, how people seek care, whatever the dynamic you're looking into. As another example of regulatory changes, you have things such as the creation of Medicare in the first place. It's not that you couldn't look at things before that, but if you're doing specifically research on senior citizens and health in the last, 40 years, Well, using data from before then is probably not going to be very comparable because so much has changed. Principle 3, make sure that you keep your notes, that you can retrace your steps and find exactly how you found a source. And in this case, I do recommend that you sign in. You can see that link there. If you sign in, that will save your search history automatically, so you can come back to it later, even after you've closed a web browser, which is especially helpful if you're like, okay, there was that source, is going to read, shoot, I didn't download it, where was it? And you can just go back through your search history. It also allows you, if you ask one of our librarians for help, to show them quickly what you've done, how you've been searching, and then can use that as the starting basis for helping you find what you're looking for. Which brings us to principle number 4. If you're not finding what you want, ask for help. We have an amazing staff of research librarians at ACU, part of whose job is to help people like you find the stuff that you need. I was on the faculty of the library at another institution, and I can tell you from experience, we like helping you out. It's really nice when someone comes and calls with a problem. You can help them find exactly what they're looking for, and they go away happy. And we all love a little mystery. The mystery is how to find the things that you need. So don't worry that you're bothering us. Ask the library staff for help. And if you're doing a search and this pops up, that means, yes, we're available. All right, let's take a look at this assignment from HCAD 256. Now, this assignment is asking you to identify a particular type of research, qualitative research, meaning research dealing with things that don't reduce or convert easily into numbers. And it starts with the preamble. Okay, the purpose of this assignment is to assist students in understanding how quantitative and qualitative research methods are used in healthcare research. And gives us a little background about what qualitative research uses, and it explains, okay, it's often used to answer questions about the whys and how. And that specific explanation there is about you have numerical data and you're trying to figure out, okay, how did we get there? Which is usually not something that the data will show unless there's been specifically asking people about that already. It's like, there's a pattern here, I wonder. And then you go and do a targeted qualitative research where you can go more in depth with people, ask follow-up questions and stuff. And the last sentence is particularly important. For this assignment, you will visit the distance learning portal and locate a health-related journal article that used a qualitative research approach. So it's telling us where you should be starting your search, what you're looking for, health-related journal article, and use qualitative research. And then, using what you know about that, answer these 5 questions. What was the problem area and research question? What were the study's concepts, independent variables, dependent variables, and operational definitions, if any? How did the author overcome the limitations of doing a qualitative study? So that's something where they might write about it. You might be having to do your own interpretation. Did the author question any collective subjective beliefs, and what were they? And did the qualitative study incorporate human concern for the client with effective social work practice? So an example there are many topics that are important in healthcare. We'll include both physical, medical, and mental care here that may be sensitive. Surgery can be traumatic. There are many experiences, such as those that cause post-traumatic stress disorder, that can be very disconcerting for a potential research participant to be discussing. So how do they go about doing this if they do this? And it says to provide examples, so specific examples there. This is going to be relatively short. 300 words is just over a page. 600 words is, say, a little less than 2.5 pages of content. And you're supposed to be writing in APA format, as with all your other assignments, and make sure you have a clear citation. There are 2 ways that could work. In some related assignments, you'll be doing an article review, and they'll ask you to give the full reference style entry at the start. But since this one does not say to do that, so long as you have the article in your references list and you have the author date citation, looks like you'll be fine. Let's check our rubric here. Identifies a problem area, research questions, study concepts and dependent variables, operational definitions. Basically, this list is going through and saying, okay, did you do everything that the instructions said? Because if we go back and check this, this is basically 1 through 5 are the first 5 items here. And then the last 2 are, okay, is this written and formatted correctly? Now, I do note that this says a minimum of 2 scholarly references. So, a question I often get from students is, how do you get 2 scholarly references if you are only doing 1? The assignment is to locate a healthcare-related journal article. Well, one way that you can do that, one way that you can incorporate a second one, is to look at how this was used or something similar. And we'll talk about some ways to find that later. At this point, though, we're going to move into searching, outlining, and drafting. And so we'll do this next section using the distance education portal. And here I am at the distance learning portal, and you'll see that we have a number of options, including contact the library up here at the top. Now, there are several different ways, and depending on how your screen is set up, if you are zoomed in, you may get this view where you start with the navigation. If you zoom out a little bit, I just hit Command- on my Mac. You could hit Control- on a PC to do the same thing. The menu will turn into a sidebar. And you'll see that we have a number of ways to contact the library staff, including you can send them text messages and chat. These hours are all in Central Time, US, but we could do a live chat during the relevant hours. You can send them a text and they'll respond when they can. Same thing with the email. The general principle, send all the information you can to help them see what you've done before. More about that in a little bit. Now the Ask Us, you can do things like include a screenshot of your search history, and available now, so you can just click on Chat Now to access that. And when you are giving us some background information, this just helps us know where you might be looking and how you might be looking. All right. Now, we are going to be starting with a basic search. So if we return to the home page, you will start and you find the search portal here. And remember, if you're seeing this, that means you're just zoomed in a bit. So zoom out. I use Command-, Control- on a PC, and then you should see that turn into a sidebar and then see the search window here. If you are in this view, just scroll down and you'll see the search, but I recommend zooming out a little bit. Okay, so you see that this limit to peer-reviewed. So peer-reviewed journal article is one where it's reviewed by usually 2 or 3 outside reviewers who look through to help ensure the quality control, that normal processes and ethics are followed and things like that. And for this search, I think it's a good idea because peer-reviewed sources are considered more authoritative than non-peer-reviewed sources. And if this is something you might be using later in another class, might as well keep it relevant. So let's say that we are looking at Medicaid usage. Let's do a search right now and see what comes up. All right, 630,000 results. That is far more than I would want to read. It's far more than would be effective to read. And because of that, it's important to put in restrictions. So just that peer review one knocks us down to 33,468. Now that is still far more than I could reasonably review. And so this brings us to the keep it current. So let's go ahead, and I'll go ahead and set this to 2018. If you are doing a search for your dissertation, then you might want to set that a little bit more recently so that it remains within the last 5 years, even when you're working on it. You can see that this has knocked it down to less than 10,000. And let's say we're being a little bit more specific. That's not something I was expecting to see. I did not know that it was still being used for medicine. Okay, anyway, let's say that you were doing research on healthcare in a particular state. Let's say Alabama. Now, a helpful thing is that the search, even though I typed in new terms, it's still limiting this to peer-reviewed journal articles and literature published since 2018. Oh, by the way, remember when I said to sign in? Here's where you want to do that. If I click on sign in here, it will go ahead and usually you'll be logged into stuff already, so we'll just refresh the page and then start recording your information. Recording your search history is good not just for you retracing your steps, but for other people to find out what you have or haven't looked at and what you've tried. So, for example, you could go to your search history and anything that you have searched for will show up here. So you could take a quick screenshot and send this when you fill out the Ask a Librarian form. Say, hey, I'm not finding stuff, and send it back. And often, our librarians will say, oh, yes, I see what you're doing. If you use this term instead, or you had that thing checked, try this one instead, and can often find what you're looking for quite quickly. So by searching for Alabama, we have cut things down to a much more manageable number. We're at 709, and let's put in senior. So you can see here, you can not only view the things you search for in the options, but you have a shortcut to view the results. You can see, okay, started with around 10,000, knocked to 700, knocked to 200, and sometimes you can be too specific. And so if you send the search history and the librarian says, oh, yes, try taking this one out to broaden the search, you may find more results. So in this case, I go here and start looking around. And let's say that I was looking specifically at electronic health record use. So this one was something I wanted to look at. So if we click on this, we can go right to the article, either as a PDF or as a web page. You can save to your account here at ACU. I personally prefer to just download everything onto my computer, but let's show what happens when you go here. So there are a couple buttons. One is you can just save this. Click on this. So now it's saved in your special results folder. You can access up here. And then also you can go to Cite. And this is a great time saver, because we have here something we can copy and paste into our references list. Now, this is a time saver. It's not perfect. It's not a substitute for having a manual review, because there are a couple things. Here, this is included for clarity, but we would not include that in the citation in APA style, so delete the ERIC. And then this text here should be in sentence case, so you turn that all to lowercase, because the title of a journal article in your references list in APA style should be in sentence case. If you're curious, a lot of this information is generated and formatted from an algorithm, which is only as good as the algorithm is and the data that it gets. So depending on how the database it's pulling from was formatted, it may be 100% accurate or it may be not. And in this case, it's going to take literally seconds to delete this and change this to lowercase. So net big time saver. Now, if you're going along, I would just say search and save. But once you start reading, if you say, okay, this looks relevant, go ahead and cite that and copy that into your references list. So let's take a look at what we get when we click on this result here. So we have the full breakdown of the authors' names. We can see their email addresses, institutional affiliations. We've got in Canada. I'm sorry, that's not Canada. UA.edu. That's University of Alabama. Texas, Dallas. And we see this is from the Journal of Management Information Systems. And you can go ahead and read this abstract here. Now, abstracts are great because it helps you determine whether something is directly relevant without having to read the whole article. And since this article here is 34 pages, that means that we can quickly screen here and see, is this what we are specifically looking for here? Now, you might be looking at this and say, wait a minute, what about that requirement for qualitative research? And I'd say, yes, that would be a very good thing to have here. So I can look at this and just add qualitative. Now, qualitative is a overarching category, and it includes things like, say, phenomenological research. And so one of the things you want to make sure is that you don't accidentally exclude something by using something that is just not the term that they're using. So you can actually have searches where you have or. So, for example, here's a way to set it up. Say, qualitative, and let's make sure that we're not excluding phenomenological research. And so you can see that this has broadened the search in certain ways. Set that to or. So you can see in this case, it's exploded the number of results because it's bringing in other things that are beyond what we're looking for. And one of the reasons is that the way we did that search, we lost our earlier restrictions. That's easy to put on. And sometimes you'll get at things where you write it into the library and they say, I noticed you stopped using that. Was that intentional? So in this case, let's go put that back on. So scholarly peer-reviewed, publication the last 5 years. And we've still got a lot of stuff here. So in this case, let's go ahead and take this away. And if you accidentally delete everything, you can always go back to your search history. So how will I get there? Well, there's this link, search history here. And you can look at this and see, that was too many. Where did I go astray? So, okay, adding this is here, 920. All right, let me go back to that one. And let me attach the date restriction, 2018. And this sometimes throws people off. When you are navigating your search history, it'll show your history at the top, and then you just scroll down to get the results. So 113, let's turn on peer review. Okay, 20, that is much more manageable. And let's go ahead and look at this one here. Okay, so check for full text. Hold on, I only want to see things that I can read now, because this assignment is due in a week. All right, so I turned that on. And now we have 17 things coming up here. Let me scroll through, and let's say that this is the article I want, or one that I'm considering. So this is reviewing literature on the topic. So this is probably not going to be a qualitative study. So let's go ahead and let's take away this one here. Okay, 113 results. Okay. This looks interesting. Let's say that we use this one here. Now, if we look through this, there's a lot of statistical analysis. That's probably quantitative. So this is, again, pointing towards a question of, is this term actually getting us the results that we want? And it could be that it's just being coded some other way, because there are many other types of qualitative research. And if you need a quick reminder, just do a search for qualitative research types, and then you'll be reminded of some of the main types. Ethnographic, historical, case study, action research. Okay, well, let's say we're looking for qualitative case study. See what that gets us. Now, this is more of a literature review, so now this one, that catches my interest. So we start with a thing, and they say, oh, results from 116 semi-structured interviews. That is a large sample of interviews, and the semi-structured interviews are generally collecting qualitative data. So, okay, that caught my interest. Let's check for full text, and you have a number of different links, so we'll use Journal Finder first. And we can get that through any one of these links. So just because something doesn't show up immediately with a download PDF link in the results doesn't mean you can't access it. It just might mean you need to click through a couple things, as is the case here. So we'll let that finish loading. While that's happening, let's take a peek at some of the other things that are here in the results. I do recommend, if you see something that looks interesting, save it. That's all I need to do to save it to the results, even if it's something you just want to come back to and peek at later. Now, in this case, if we look back, we see this is 2021, volume 53, issue 4. There's our issue. And we could check the abstract again if we wanted. We can click on this. We can grab a PDF, which, again, is what I prefer to do. So I'm downloading that in another tab. And you can just start reading here. Now, one thing you might be searching for already, we have our list of things that you need to find out in this assignment. And, okay, problem area and research question. So it's helpful to do a search to see if a word search can help you identify what you're looking for quickly. And they might be coding something as problem or issue, and the research question should be responding to this. And in this case, they say it examines administrative workarounds. And so the workarounds are generally trying to get around a problem. So let's take a quick look at the abstract. In this sentence, workers from nearly every occupational group engage in non-compliant behavior, not being compliant with rules. So that seems like the larger background problem. And they seem to be specifically saying that, okay, but there's not an integrated perspective to recognize why this happens. And then they have this justification of the research. Okay, good. They have the kind of information we're looking for here. Now, okay, studies concepts, independent variables. So concepts, when you see them defining things, that's telling us key concepts. And so they define rule bending here. They define workaround. Great. They even explain why it's there. Variables, independent. Well, if we do a search here for a variable, we don't find that. Now, that doesn't mean there isn't a variable, but they may not be writing about it in that term. Now, looking at operational definitions, and if you don't find any independent or dependent variables, mention that. That may not be specifically being tracked or coded as something being tracked in a qualitative study. Same thing with looking for collective beliefs. There's many different ways that could be written, so make sure that you are looking into that. And here we see they're discussing key terminology, so make sure you fill out the sections accordingly. And they even have a table that you can view here that breaks down that. So it's something you can certainly describe. Now, we mentioned different ways that you might get that second source. Well, here they're drawing on this article about administrative burden. And so if you chose to read this article and discuss part of it and how it's employed here, you could certainly be citing and referring to that as well. Okay. Human concern. Now, one of the benefits of a word search is you can look quickly to see if that can help you narrow down what you're trying to identify. And not everything is, but for example, this brings us to the research questions that they asked, which is certainly something described here. And see, okay, we've got the four research questions that they discuss. And they have not just the questions, but also talking about what they anticipated based on what they knew before, and some of the rationales for the questions. And here's a specific description of the method, and that they're specifically only looking at interview data. Now, they say it's part of a larger study, so if this wasn't something that was just published last year, I might recommend going and looking for that larger study where they have the different data types. But here, this is an extract of stuff that they're going through now. And so you can look through this and see, okay, this was done in a particular part of the United States. And then they provide the interview protocol, which will give you an idea of some of the concerns they were trying to manage, and any actions they might have taken out of concern for the participants. Now, this is probably fairly safe as it goes. It's not something that's expected to be invoking trauma normally, but if it was, that would normally be described either in the protocol or in the notes about the protocol. So I think that's given an idea of some of the things that you can be looking for and how to look for them. Make sure that you go through and check off all these, including if something isn't present, stating that it's not there or the author doesn't do it, because that will tell the professor that you have checked that, rather than if you don't find it and simply leave it out, they won't know whether you've done that or not. All right. Make sure when you are writing things up to use your APA course paper template. And with that, I think it's time for us to bring this to a close. So if you have any questions, feel free to contact the Online Writing Center. You can contact us via email, simply schedule an appointment, find webinar videos and other resources on our website. Have a good night, everyone.